This is the first in a series of films for AmplifyChange grantees and applicants who are planning advocacy campaigns. The series will take you through a step-by-step guide to facilitating the development of an advocacy strategy. They are aimed at applicants and grantees who advocate to change policies or laws, including policies that are made at the national level or more devolved levels of government. All these exercises are designed to be collaborative. You are going to work with your colleagues and fellow advocates through a series of simple exercises to identify a common problem you want to tackle together regarding sexual and reproductive health and rights. Draw out and prioritize the causes of the problem. Agree on clear objectives. Identify decision makers. Analyze stakeholders. Develop messages. Plan tactics and assess risks. By the end of this process, you'll have an advocacy plan fit for your AmplifyChange application or to guide an existing or new campaign. This film will discuss how to work with your fellow advocates to identify a common problem you want to tackle together regarding sexual and reproductive health and rights, draw out and prioritize the causes of the problem. Before you get started, think about who could help you plan. Bring together key decision makers from your organization and your trusted coalition partners to complete the exercises together. We also strongly recommend engaging people who are most directly affected by the issues you are working on, as well as experts, for example, in medicine, law, or politics. More about that later. We recommend using a flip chart or large piece of paper. If you don't have these, you could even write on a chalkboard or on the sand or soil and then take a picture of it. This helps to capture the conversation together. So, nominate a facilitator and get some markers. Advocacy is best when it is nimble and responds to the ever-changing political environment. So, we recommend that you constantly update your strategy and planning through the life cycle of your campaign or AmplifyChange grant. Step 1. Identify the problem as specifically as possible. AmplifyChange funds groups advocating on sexual and reproductive health and rights. But be careful not to be too general. For example, by just saying, we want to improve sexual and reproductive health. Consider the specific sexual and reproductive health and rights issue or issues you are trying to address. Is it teenage pregnancy or removing barriers to safe abortion? Ending child, early, or forced marriage or female genital mutilation? Or decriminalizing love between two people of the same sex? Or tackling stigma related to menstrual hygiene? The clearer the members of your organization are about what exactly the problem the group wants to address is, the more likely your project is to make progress towards solving it. Ask the group why it is that they want to change this sexual and reproductive health and rights issue, what motivates them to do so, and how they came to hold their opinions on the issue. Then ask the group what research or other kinds of evidence, such as the opinions of the people most affected, they can think of to help you. We often seek the advice of experts, but don't forget that the people who face the issue on a daily basis or work on the front line often have some of the most important insights. Step 2. Once you have identified the core problem, you should begin to draw out its causes. One way to do this is to bring your group together, write the problem you have identified on a sheet of paper in front of everyone, and ask the group to explain what they think has caused the problem. To each answer, keep asking why, and dig deeper into the chain of causes. You might find that the problem has several interrelated causes. You can draw the causes and effects of the core problem as a problem tree. Start with the issue you are going to address. Our example group might ask one another why the prevalence of teenage pregnancies is so high. Below that, write the things that are causing the problem or preventing change from occurring, and below each of those, specify the factors that are contributing to the causes or preventing change. Keep going until you have reached the root causes. Above the core problem, write down its effects. This will be very useful later in the process for crafting your narrative when planning activities. Step 3. Having done this, you can turn your problem tree into a list of priorities. If you could only deal with one of the causes of the problem, which one would it be? This is probably your top priority. You could offer each member of the group slips of paper with each cause on and ask them to arrange them into a list by priority as a way to begin a discussion between members of your team about the order of priorities. Alternatively, once the priorities are marked on a flip chart, Post-its could be used to assign numbers to the priorities. For example, the greatest priority could be assigned a 10 and the least a 1. As Amplify Change is a fund for advocacy, we are going to focus on the problems that are connected to policies, laws, or budget allocations. If you found this helpful, continue to the next film, which offers tips on how to get your group to agree on clear objectives, identify decision makers, and analyze stakeholders.